Vera from BSN 2A Group 2, and today I'm going to demonstrate the administration of oral medication. So for the main purposes of this is to provide a medication that has a systematic effect or local effect to the gastrointestinal tract or both. And now let's proceed for the preparation. So in preparation, first is we have the assessment. So in assessment, we need to assess our patients if our patient has allergies to the medications, especially to the medication that we are going to give. And then also if we need to determine the ability of our patients or the ability to swallow the medications, and also if our patient or client is experiencing vomiting or diarrhea that can interfere the absorption of medication, and also the drug action, the side effects, the interaction, and the adverse reaction, and the client's knowledge about the medication. And also we need to perform a appropriate assessment prior or specific to the medication, and we need to determine the assessment date if it will influences the administering the medication. And now let's proceed for the planning. So in planning, we need to prepare and assemble all the equipments that we need. So we have here the alcohol, the disposable gloves or the clean gloves, and we have here the water and also the disposable cups for the medications. Here is the medication cup for the liquid medication, and also we have here the cups or the small cups for the tablets or capsules, and we have here also the syringes or syringe, and also the medications that we are going to use later on. And then also we have here the tissues, and that's all. I have here also the straw, so in straw. And then now let's proceed for checking the MAR. So by checking the MAR, here's the MAR. First we need to check the name of the drug, the dosage, the route of administration, and also the expiration date prior or specific to the administering medication if appropriate. And then if our MAR is unclear or if there is a missing pertinent information, we need to compare it to the previous primary care provider's order, and then we need to report any discrepancies to the charge nurse, and also or maybe to the primary care provider as the agency policies dictate. Then now let's proceed, we need also to read the MAR or the label of the MAR. So by reading that, there will be the when it was taken from the the medication card, and also before withdrawing the medication and after withdrawing the medication. So now let's proceed for the implementation. So in implementation, first thing you need to do is perform hand hygiene. It will be better if you are going to wash your hands, but I prefer here to use a alcohol. So let's use alcohol. You can also use a sanitizer, and then you need to perform other appropriate infection control procedure by you can use a clean gloves. And then now we need to prepare all the medications that we are going to use. And then by preparing the medication for the tablets or capsule, first thing you need to do is to get the medication with its wrap, still wrapped, and then put it on the disposable cup or the medication cup. And then always remember not to open the medication yet. If you are, as long as you are at the bedside of your patient, as you are in the bedside of your patient, you can now open or unwrap the medication. But as we are preparing it, do not open it yet. And then if you are using a stock container like this one, and then there's a medication inside, first thing you need to do is open it and then get the amount or the numbers of medication that you are going to use, and then put it on the cup of the container or this little bottle. And then without touching it, you need to transfer it in the disposable cup or a medication cup. So without touching it, you need to put it here. So, there you go. Then you need to close the container. And then you need to keep the narcotics and medication that needs to have a specific assessment. You need to separate them. The specific assessment that I am talking about is by taking the pulse rate, the respiratory rate, and also the blood pressure. And then, let's say for instance, you go to the pharmacy, and then you need to get the right dosage of the tablet for your patient, and then in the pharmacy they said to you that they tell you or they say that the medication or the dosage of the medication is not available, but they have higher dosage than that, so you can still get that, and then you need to cut it and get the proper or the appropriate or the right amount or right dosage that you need. So you can cut it, and then you need to read, or you need to to go to the agency policies on what you are going to do with the medication that you are not going to use, or that one that you cut, then you're not going to use that. So go to the agency policies, and then check if you are going to discard it, and if you are going to discard it, how will you discard that medication. Okay, and then you can use a pill crusher for that. I know, not pill crusher, the cutter, okay, the pill cutter. Then if your client is experiencing a hard to swallow or can't swallow properly, you can crush the tablet or the medication by using a pill crusher, or like for example these 2 cups, and then you need to crush it this. Then by crushing it, you need to make sure that it will become powder, and then that powder you can mix it in a small amount of soft food, like for example this one, and then in a applesauce. Like for example, this is applesauce. Then you need to mix it, and then give it to your patient later on. So now let's proceed to the liquid medication. So first thing you need to do for the liquid medication, or preparing the liquid medication, you need to shake or mix the medication. So let's say for instance this one, and then you need to check the color of the color of the medication, and if it will become cloudy like that, you need to discard it already. And then you need to remove the cup, and then like this, and then you need to place you need to place the what you call this one, the cup of the bottle like this upside down, and then put it on the countertop or a table, and then you need to hold the bottle like this one in your palm, and then get this medication cup, and then put the medication cup on your eye level, like this one, and then you need to pour the medication. You need to make sure that the flow of the medication will be at the center or the middle. So like this, and then by getting the right amount or right right amount of the medication, you need to get the bottom of the meniscus. So by checking that, let's say for instance I check it. So before you close the bottle or of medication, you need to wipe first the lid of the bottle. So get a tissue, and then discard this tissue, and then close the bottle. And if you are going to give a smaller amount of medication, you can use a syringe but without the needle. So this one is syringe, or you can use the special designed oral syringe for that. Then you need to label the name of the medication and also the route of administration. And now for the procedure for all the medication. First thing you need to do is to place the prepared medication and also the MAR together to the medication cart, and you need to recheck the label on the container before you are going to return it to returning the bottle or the box or the envelope to their proper places, to the storage room or the storage area. Then you need to avoid leaving any prepared medications unattended. Then you need to lock the medication cart before you enter the client's room. And then as you are in the client's room now, let's say for instance I'm in the client's room now, you need to provide the privacy of your client. So by providing the client's privacy, you need to make sure, if you're in the room, make sure that you close the door and also the window, and if there's a curtain, you need to close the curtain. And then you need to prepare the client, and then you need to check if you are in the right patient. So by checking that, you need to check the wristband or wrist tag, and then ask your patient the full name and also the birth date. And then you need to assist your patient in a sitting position, or if not possible in a side lying position. And then if your patient is not yet taken a assessment or the required assessment, you need to take let's say for instance I have my sphygmomanometer and also the stethoscope. So get the pulse rate, also the respiratory rate, and also the blood pressure. Then after that, you need to explain to your client what you are going to do and all the purposes and how the medications can help him or her. And then you need to use a language that your patient can understand, and all the side effects or the normal effects, because it can help your patient and also you if he or she knows the normal and the abnormal effects. Because like for example, he or she felt something and then she realized that it is abnormal effects of the medication, and then he or she can quickly report it to you that he or she felt something abnormal effects of the medication. So next is you need to administer the medication at the right time. So by doing that, you need to take the medication before and after, like 30 minutes before or after the scheduled time of the medication, and then you need to give the client sufficient water. So, and you can also use a juice, but make sure that it cannot contradict the medication that you have been given. And then if the client is unable to hold the pill or the pill cup, you can introduce that like this to your patient, but make sure that you are going to give a one tablet or capsule at a time. And then if your patient or client is cannot swallow well, you can tell the patient or the client to use, like for example, the tablet then or the capsule, place it on under the tongue and then give a water. So that's it. And then, and if the medication has a objectionable taste, you can ask the patient to take any parang, I sorry for the parang, like ice chips beforehand, or you can use a juice or applesauce, but make sure that it cannot contradict the medication. And then you need to stay with your patient or client until all the procedures, and making sure that all the medication has been taken by the patient. So by doing that, you can assess the mouth of your patient. You can tell him or her that, ma'am, sir, or sir, can I assess your mouth? And then you can tell him or her to open um, his or her mouth, and then check side by side and also the tongue if there is still a tablet, because sometimes there is a patient that they didn't want to take their medication. So it would be better if you check if they have been taken all the medications. And then you need to document each medication given by their, you need to record the medication given, the dosage, the time, and the complaints of your patient or client. And if the medication was refused, or if the medication was refused or omitted by your client, you need to record also that, and also the nurse or the action that you have been done about that, the actions, and or according to the agency policy. And before I forgot, before you document all of that, if your if the patient said that you're giving the wrong medication, or you are giving a medication that and he or she noticed that it is not the medication that he or she have been taking, so you need to first to check the original record before you give the medication. So now let's proceed for, and then after all of that, after you document all the medication or all the actions or all documentations, all the findings that you've got, you need to discard all the disposable equipment. So let's say this one, discard it, and then perform hand hygiene. You can wash your hands, but I use here the alcohol, and you can also use a sanitizer. And then now let's proceed for the evaluation. So for the evaluation, you can tell your patient to return to you to if you are expecting any effects or side effects, for you to evaluate that side effects. And for the administration of Otic installations, the purposes of this is to soften the earwax so that it can be readily removed or readily removed at a later time, and then to provide a local therapy to reduce inflammation, and also to destroy the infective microorganism or organisms in the external ear canal excuse me, or both, and also to relieve pain. And now let's proceed for the preparation. But first, for the preparation is we have the assessment. So we need first to assess our patients or client, or I mean the appearance of the pinna of the ear and also the meatus for the signs of redness and abrasions, and also the type and amount of any discharge. And then we need also to determine the assessment data that influence the administration of medication. And then now let's proceed for the planning. So we need to gather and assemble all the equipments that we need. So we have here the alcohol, the irrigation solution, tissue, also a clean gloves, and we have also here the applicator sticks or the cotton tip. Then we have also the right solution with a dropper and cotton fluff. And we have also the syringes or syringe, and also we have the cotton, and also here is the kidney shaped basin, and also the MAR. And then in MAR we need to check the MAR for the name of the medication, and also the dosage and the route of administration, and also the expiration date of the medication, or for the administering medication if appropriate. And then if our MAR is unclear or there's a pertinent information that is missing, you can compare the MAR to the previous primary care provider order. And then you need to report any discrepancies to the charge nurse or maybe to the primary care provider. And we need to know why our patient is taking or receiving the medication, and also the drug classification, and also contradictions, and also the side effects, and nursing considering the administration of or administering the medication, and also the evaluating the intended outcomes of the medication. And then you need to read to the MAR the label of the MAR when it was taken by the medication cart, also before withdrawing the medication, and after withdrawing the medication. And also you need to check for the expiration date of the medication. So now let's proceed for the implementation. So for the implementation, first thing you need to do is to introduce yourself and explain to the client what you are going to do, why it is necessary, and how he or she can cooperate with us. So, hi sir, I'm Rochelle Rivera. I'm your nurse for today. So can I know your full name? May I know your full name? And also your date of birth. And then after knowing that we are in the right patient, you need to explain to the client how the client might felt like a fullness, warmth, and occasionally discomfort when the fluid comes in contact with the tympanic membrane. And then you need to perform hand hygiene and observe other appropriate infection control procedure. So it would be better if you were going to wash your hands, but I prefer you to use alcohol, and you can also use a sanitizer. And then you can put your clean gloves. And then after putting your clean gloves, you need to prepare all the medications that we need. So you need, if necessary, you need to calculate all the medications. So let's say, for instance, I prepare all the medications now, and then we need to provide the client's privacy. So by doing that, if you are in the room, make sure that you close the door, the window, and if there's a curtain, you need to close the curtain. And then you need to prepare the client by assisting the client in a comfortable position with a for the ear drops, you need to lie in the ear being treated. So let's say, for instance, this is the part that we are going to treat. So sir, are you comfortable? So as our patient said yes, Now we need to clean the pinna of the ear and also the meatus. So by that, you need to have this tip or cotton tip and also the solution. So let's say for instance, we on the solution and then clean pinna and also the meatus by using this one. Then discard it. And for the administering the Otic medication, first thing you need to do is to warm the medication with your hand, or you can place it in a warm water for a short time. Then partially, you need to fill the eardropper or fill a medication to the eardropper, and then you need to strengthen the auditory canal. You need to pull the pinna upward and backward. So let's say for instance like that. And then you need to instill the correct number of drops along the side of the canal. So let's say 3 times. So 1, 2, 3. And then you need to press gently but firmly a few times the tragus of the ear. So like that, and then you need to ask the patient or client not to change the position or still in a side lying position for about 5 minutes. So sir, can you please not to change your position for about 5 minutes? And then you need to insert a small cotton fluff loosely at the meatus of the auditory canal for about 15 to 20 minutes, and like this. Do not press it, okay? And now for the otic irrigation, so remove this one. You need to assist the client in a sitting position or lying position with the head turned toward the affected area. So, sir, let me help you in a sitting position. Like that. And then you need to place the moisture resistant towel around the shoulder of your patient under the part of the on the ear to be irrigated, so like this, and then get the container and put it under the ear to be irrigated. Then you need to fill the syringe with solution, or you need to hang up the irrigating container and run solution through the tubing and nozzle. So get the syringe and then the irrigating solution and get some of it, one, and then you need to strengthen the ear canal, and then insert the tip of the syringe into the auditory meatus. So let's say for instance this one is in here, okay? So we need to strengthen this one. And then you need to direct the solution gently upward against the top of the canal. Then continue instilling the fluid until all the solution is used or until the ear canal is clean. But you need to take care not to block the outward flow of the solution with a syringe. And then you need to discard this one and help your patient in a comfortable position but in a side lying position. So sir, like that one, and then put a small cotton fluff. So sorry, let me help you. Like this one. So this one, put it in here. Do not press it, and by doing that, it can absorb the excess fluid. And then you need to remove your gloves, discard it, and then it will be better if you are going to wash your hands, but I prefer you to use a alcohol. And you can also use a sanitizer. And for the evaluation, you need to assess the client's response, assess the character, the amount of discharge, appearance of the canal, discomfort, and so on. And immediately after the installation, and again, when that medication is expected to act, you need to inspect the cotton balls for any drainage. Then, document all the nursing assessments and interventions relative to the procedure, and include the name of the drug or irrigating solution, the strength, the number of drops, and if it was a liquid medication, the time and the response of the client. And now for the administering the ophthalmic installations. The purposes of this is to provide an eye medication to the client requires, like antibiotic, and also to treat an infection or for others. And then for the preparation, so the assessment first, we need to assess the appearance of the eye and surrounding structures for lesions, exudate, erythema or swelling, and the location and nature of any discharge, and also lacrimation and swelling of the eyelids or of the lacrimal gland, and the client complaints such as itching, burning pain, blurred vision, and photophobia. And also the client's behavior such as squinting, blinking, excessively frowning, or rubbing the eyes. And also we need to determine if the assessment data influences the administration of the medication that we are going to give. And now let's proceed for the planning. So we need to assemble and prepare all the equipments that we need. And as we prepared it all, we need also to check the MAR, the medication administration record, to know the name of the medication, dosage, and also the amount of drops that we are going to give to the patient, and also the expiration date of the medication, or as administering the medication if appropriate. And we need also, I mean, if there is a unclear or missing, pertinent information that is missing to the MAR, you can compare it to the primary providers written orders, and also you need to report any discrepancies to the charge nurse, and also you can report it to the primary care providers as the agent policy dictates. And then you need to know why the client is going to receive the medication, and also the drug classification and contraindications, usual dose range and side effects, and the nursing consideration for the administering the medication, and evaluating the intended outcomes of the medication. And then now we need also to read the label of the MAR. By doing that, when the medication taken from the medication cart, and also before withdrawing the medication and after withdrawing the medication. And always check for the expiration date of the medication. And now let's proceed for the implementation. So for the implementation, you need to introduce yourself to the client and explain what you are going to do, why it is necessary, and how he or she can cooperate with us. And then you need to perform hand hygiene. It will be better if you are going to wash your hands, but I prefer here to use alcohol. You can also use a sanitizer, and then you can wear a clean gloves as do other appropriate infection control procedure. As you wear your clean gloves, now you need to prepare all the medications. So let's say, for instance, I prepare all the medications. If necessary, you can calculate the medication dosage, and then you need to provide the privacy of your client. So if you're in the room, make sure that you close the door and also the window, and if there's a curtain, you need to close the curtain. And then you need to prepare the client. You need to assist the client in a comfortable position, either in a sitting position or lying. And then you need to clean the eyelid and eyelashes. By doing that, you need to have the cotton balls, the sterile cotton balls, moisturized with the sterile irrigating solution or the sterile normal saline, and then you need to wipe it to the eyes of our patient from the inner contours to the outer contours. So let's say, for instance, this one. Then discard, then get another one, and then yeah, inner contours to the outer contours, then discard. For administering the ophthalmic medication, you need to instruct the patient or client to look up the ceiling and give a dry, sterile absorbent sponge. So let's say, for instance, I give that now. Then expose the lower conjunctive sac with your non-dominant hand, and then you need to put the thumb or your finger at the cheek of your patient, and then you need to drawing down um, the skin of the cheek. And then if the tissues are edematous, you need to handle it with care, or you need to be careful not for you not to damage the tissue or damaging the tissue of your patient here. Then you need to hold the medication with your non-dominant hand. So let's say, for instance, this is the medication, and then you need to place it in the forehead of your patient. Establish your hand, and then you need to instill the correct number of drops. So let's say, for instance, your doctor or your primary care provider's order is 3 drops. So you need to drop the medication for about 1 to 2 centimeters away, or 0.4 to 0.8 inches above the sac. So 1, 2, 3. And then you need to instruct the client to close the eyelids, but not to squeeze them. So sir, please close your eyes. And then for liquid medication, you need to press firmly, or the clients press firmly on the firmly on the nasolacrimal duct for at least, or for about 30 seconds. And for the ophthalmic irrigations, you need to place absorbent pads under the head, neck, and shoulder, and then place the basin later on. So here's the neck, to the shoulder, and also to the forehead. So there you go. And then the basin. So you need to expose the lower conjunctive sac. So like that. Let's say, for instance, it's in here. So there. And then you need to feel and hold the high irrigator about 2.5 centimeter or 1 inch above the eye. So let's say, for instance, this is the irrigator, and then you need to irrigate the eye, directing the solution onto the lower conjunctive sac and from the inner contours to the outer contours. So there you go. And then you need to irrigate until the solution leaving the eye is clear, or until all the solution has been used. Then after that, you need to instruct the patient to close their eyes periodically, like that. Then remove this one, and then you need to clean and dry the eyelids by using a you can use like this one, cotton balls, and then you need to dry it from inner to outer And then you need to apply an iPad if needed to secure it with to secure that you need to place a paper tape. So here we are going to use 2 tapes. And now for the evaluation, you need to assess the client's response, assess the character and the amount of discharge and appearance of the canal, discomfort, and so on immediately after the instillation. And again, when the medication is expected to act, inspect the cotton for any drainage. And then you need to document all the nursing assessments and interventions relative to the procedure, including the name of the drugs and irrigating solution and the strength and the number of drops. If it was a liquid medication, you need to write the time and the response of the client. And that's all for the